Hello, my name is Janka Kocsis. I'm the Alliance Manager of the Innovative Pharmaceutical Manufacturers Association from Hungary. We are extremely grateful for the invitation and for the opportunity to present our results of our research from the last year. It is a truly honor to be part of such a great professional event. One of the AIPM's main priorities is to support the work of the Hungarian patient organizations. Over the past years, the AIPM patient think tank has been stronger with the aim of creating a fully equal forum to discuss the current health issues in every third month. Last year, for the first time, we held our patient organization meetup, a fully public open event. Then in the fall, we launched our patient organization leadership academy with 13 participants in the first year. A year ago, at one of the AIPM patient think tanks, the participants and we all agreed that it would be really powerful if we could quantify the amount of the work that the patient organization does in terms of forints. The aim was to show that not only the value of the work done by the patient organization huge in a sentimental value, but that would be also show strong numbers in financial terms if it were funded, for example, by the state. The AIPM felt that it was important to put these numbers in the hands of the patient organizations as a tool to help them to make their work more understandable and visible to people who do not currently have such a deep insight. To develop the methodology of the research and then to carry out the entire research, we asked a credible Hungarian consultant in the field of health economics. Thanks to the excellent professional work of MediConcept, the literature research, an online survey, and an in-depth interview scheduled were compiled. During the in-depth interviews, we completed a list of previously produced summaries on the activities of the patient organizations. These were included in the online questionnaire, which was completed by nearly 40 patient organizations. The results was an indication of which activities are carried out by the organization, how often, and if identifiable, for how many hours. We then calculated the market value of this activity. For example, what would be the cost of a prevention program if it was not organized by a volunteer team, but by an event organizer, also with a market fee, if the expert had given a presentation, and so on. Here, I would like to highlight one of the difficulties we faced again during the research. Today, in Hungary, there is no list of active patient organizations. One reason for this is that there is currently no definition of patient organization in law. We hope that this will change soon, and AIPM feels it is an important goal to support this process. There are more than 1,500 NGOs in the current registry that have a health activity, so we have manually filtered out a few hundred of them that are maybe patient organizations, and if we found the working contact, we sent out the questionnaire. We believe that the survey was a groundbreaking in this aspect as well, as it highlighted the painful gap in the database. The first interesting result came when we ranked the activities that the most patient organizations do. The ranking shows that there are some similarities with the European practice from the study of European Patient Forum, for example, in the field of prevention and patient education. But also some differences. For example, patient journey management, which is a more typical activity in our country compared to the European survey, is in a strong mid position in the overall list. Of course, this raises further questions, such as whether that the activities carried out by the patient organizations are a reflection of the healthcare system in the given country, and in which areas their niche work may be the only solution. Furthermore, is it the good way to have NGOs actually carrying out state functions without state funding? It's not for us to take a position on this question, but it is an important opportunity to start the discussion with the stakeholders on these issues. A similar issue is the right to equal access. Those patient organizations that have an established strong reputation for their outstanding work in the field of care have achieved that their members can receive certain benefits, for example, if they need urgent radiology scanning. This is indeed a great achievement for the NGOs, but again, the question is, the patient organization can be used as a tool to shorten waiting lists for their members. The aim of the research was to determine foreign data, which we were able to determine from the fill-in data as shown in the figure. The fig itself is impressive in terms of the average value on an organization certain in forint. I would like to highlight, for example, prevention activities. That would be the market value of the activities they do, but thanks to the very creative, good organizations and a lot of volunteer work and supportive speakers, they are organized as such smaller budget in general. Overall, whatever we look at the market or the actual amount, the actual result is much higher as the return on the euro spent on prevention is many times higher. Think of the chronic disease diagnosed at the early stage, or the same with the patient education. For example, if a patient with a chronic condition has a strong adherence thanks to the patient organization that understands and values his or her therapy, there is much less chance to a rapid determination in his or her condition or even the need for acute hospitalization, all of which are cost-saving at the national level. At present, without knowing the exact Hungarian list of patient organizations, it is not possible to make credible national count. Our aim is to know in the future the exact how much the total value of the work of the patient organization would be in the country. The research has shown that it would be important to extend it in several directions, as some typical patient organization activities could be analyzed separately and in more detailed way. It would be also great to get a complete picture of the Visegrad Force or CE region. The first component in that, the Czech research from NAPO, the result of which was presented in a webinar organized by FPA together with the AIPM research. Of course, the scope could be extended further, as it would be interesting to see what other EU countries or even the states would show. If you have any further question about what was said, I'm available by email, and thank you very much for your attention.